Hi, my name is Elizabeth Toon, and today I'm going to be assessing the respiratory, vascular, and neurological systems to help determine a pulmonary embolism.
Come in.
Hi, how are you doing today?
All right.
Good. My name's Elizabeth. I'm going to help you out here. Can you tell me your name?
Yeah, my name's Paul Buford.
Nice to meet you, Paul. What brings you in today?
I've got this really pain in my chest, and I have difficulty breathing.
Okay.
On the right side.
Okay. Can you tell me more about that pain? Like, when did it start?
It started this morning. It's just a really sharp pain when I take deep breaths.
Okay. Is there anything else that triggers it? Like exercise, going upstairs?
No, just breathing.
Every time you breathe. Okay, darn it. Well, can you rate that pain on that 0 to 10 pain scale?
I would give it a 7.
A 7. Okay, so pretty severe. Can you describe it for me? Like, how does the pain feel?
It's very sharp.
Very sharp pain. Okay.
Sharp pain right there.
Okay. And then, yeah, I think that pretty much covers that. So I'm gonna go ahead and do a quick respiratory assessment on you, since that seems to be the issue here. So we'll go ahead and I'm just gonna, if it's okay with you, are you comfortable in that position?
Oops.
Great.
Sorry, I almost dropped the phone.
Okay, so I'm gonna go ahead and just do a quick measurement here to make sure everything looks okay. If you could just sit up nice and tall for me. Thank you. All right, and come around the back here. Perfect, that looks good. Do you have any respiratory history, any respiratory problems that you've been diagnosed with?
No.
No respiratory? Okay. And any other relevant history that I should know?
I just had surgery on my right knee
Okay.
a couple days ago.
Okay.
And I also have been diagnosed with factor V deficiency.
Oh, okay. All right, good to know. That definitely increases your risk of clotting. So that is good to know. All right, and am I okay just to lift up your shirt here for a second?
Sure.
Okay, thank you. All right, it looks like you're maybe using a little accessory muscles there, like you're kind of struggling to breathe. Is that how you feel? Are you able to take a breath? All right, yeah, and definitely we're not getting as good of an expansion on that right side. Okay, how does it feel when I press right here? Do you have any pain?
Yes,
Okay.
right there.
Okay, great. On this side, any pain?
Nothing.
Okay. Okay, well, I'm going to kind of bang on your chest here for a second, just to see how your lungs sound, if they're nice and inflated. That's definitely a little duller on that side. Like we're not getting great expansion there. Okay, can you lift up this arm for me? Thank you. Okay. And go ahead and lift up your left arm. Okay, you can drop that arm. And I'm just going to reach around the back here and do the same thing. Again, I'm just checking to see if our lungs are nice and open. And I'm definitely noticing a difference on that right side. Okay, and one last test. I'm going to have you, as best you can, I know it's painful, but try to take a really big deep breath in for me and hold it. Okay, and then breathe out all the way and hold it. Okay. It's about 3 centimeters. Maybe a little low for your side. All right, and then we'll go ahead and just listen to your breath sounds. Let's see if there's, have you had a cough at all? Any cough?
No.
No cough, okay. All right, sit up nice and tall for me. Take a big deep breath, in and out. And I mean, if you start to get dizzy at any point, let me know. This is a lot of breathing. All right, we sound good up here. Big deep breath. One more time on the side. Okay. Another time. Okay, can you lift up this right arm for me again? Thank you. Big deep breath. Big deep breath. All right, you can go ahead and put that arm down. Lift your left arm for me. Thank you. All right, go ahead and relax your arm down. All right, I'll give you a little breather here. You doing okay?
Mm-hmm.
Okay, and now we're gonna do some more big deep breaths. Just in and out, perfect. Okay, so there's definitely a difference between the right and the left side. There's a good chance it might be caused possibly by a clot. So I kind of want to inspect some other areas to see if we can figure out where this came from. So I'm just going to do a quick assessment of your extremities, and then we'll go from there, okay? So just want to take a peek here. What kind of... Sorry, can I remove your glasses?
Mm-hmm.
Thank you. Just gonna test your pulses here, make sure everything looks okay. Our skin looks good. Do you have any cuts, bumps, bruises anywhere aside from your knee?
No.
Your muscles make it challenging to feel this pulse. Okay. Borrow your arms from you here. And no pain or anything in any of your upper extremities? No.
Nope.
Okay. Those feel good. Let's do those. Okay, so now your legs. Now you just had surgery on this knee. So I'm going to leave that one alone here. It's probably pretty tender, but I'm going to feel a little bit lower. Any pain in any of your legs aside from your knee?
Nope.
Not really? Okay. Good. Well, this side's a little weaker than this side, but you did just have surgery. We're just going to kind of feel... Ooh, it's a little red and swollen back here. Is it a little tender?
Yeah, that's a little tender right there.
Okay, I'm going to kind of press on you. Okay, definitely you've got some edema there. I'd call that probably +2. And it almost feels like you have a knot. Okay, I want to do a test, but for this I'm going to have you lay back, flat on your back. This test is called the Homan's test, and it's to help us determine whether there's a possibility of a blood clot. So lift up your leg here. Can you bend your knee a little for me? Thank you. So I'm going to push your toes up towards the top of your head. You let me know if you have any pain in the back, okay?
Okay.
Any pain on this side?
Mm-mm.
Okay. Now we're gonna have to be extra gentle with this side because you just had surgery on that knee. Try to support that. All right, I'm gonna push. You got some pain on that side?
Yeah.
Okay. All right. Well, go ahead and sit up for me. I'll help you up. So, I think we're gonna need to probably do an ultrasound of that leg just to make sure that to determine whether there really is a clot there. Last thing we're gonna go through is I'm just gonna do a neurological assessment. I know that you've been in some respiratory distress, and I want to make sure that everything is working in the brain department. So, can you tell me your name?
Paul Buford,
Perfect. And can you tell me where you are?
the doctor's office.
Perfect. And can you tell me what month it is?
Believe it's March.
Okay. All right. Good. And then we're gonna go through. I just want to make sure that other things. Do you remember what my name was?
Don't.
Okay. I'm gonna have you close your eyes. Okay. And I'm gonna put something in your hands. And can you describe what this is for me?
It feels like a hammer.
Perfect. Okay. Good. Good. And then can you tell me your birthday?
May 1st, 1985.
Perfect. And then I'm going to tell you a series of numbers, and if you could repeat those back to me, that would be great. The numbers are 4, 12, 15, 1, and 7.
4, 12, 15, 7, and 1.
Okay, good job. Awesome. Okay, and then we're just going to go through and do a couple different things here. So I'm going to touch a point, and I want you to tell me where I touched, okay?
With my eyes closed.
Sure.
My fingertip,
Okay, on what side?
the right side,
Okay.
the left finger, next finger.
Okay, I'm going to open your hand up. I'm going to draw a letter in your palm, and I want you to identify the letter.
E, G,
Okay,
C,
good, good. Awesome. Okay, and then we're going to, I'm going to go ahead and touch you in 2 different places and see if you can tell me where I am.
left elbow,
Okay,
and the right wrist.
perfect. Okay, and then we're going to do some reflexes here. So we'll start up here at the bicep. I want you to kind of relax your arm here. Okay. Let's try this side. Good. Then we're going to go a little lower. Good. Good. Okay, I'm going to have you kind of hang your arm to the side if you can. Okay. Perfect. All right, and then we'll go ahead and do, I'm going to avoid this knee, but we'll check this side, make sure reflexes are okay. Very good. Awesome. Okay, well, I definitely think that we need to go ahead and do a chest x-ray just to help determine and also get some lab work done to make sure, rule out a heart attack, and also an ultrasound of your leg to help us determine whether there's a potential that maybe